Hi everyone, welcome to today's session. Today we're going to see question and answers from oral anatomy. So moving on to question number 1. In Palmer notation, the teeth number 3 refers to, they've given us 4 options: central incisor, lateral incisor, canine and first molar. The answer is canine. So let's see the Palmer notation chart. You can find that in the permanent dentition, number 3 is denoted for canine. Moving on to question number 2. The teeth that is present in a 1-year-old child are incisors in canine, incisors in first molar, incisors in molar, and canine and molar. The answer is incisors and first molar. When you look at the chart, you can find that the incisors and the first molars have erupted by the time the child has attained 1 year. So moving on to question number 3. The last succedaneous tooth to erupt is, they've given 4 options: maxillary canine, maxillary first premolar, mandibular canine, and mandibular first premolar. The answer to this question is maxillary canine. So let's look at the picture. You can find that in the time of eruption of the maxillary canine is around 11 to 12 years, which means at 11 to 12 years, the tooth has, the primary dentition, the primary tooth has shed and the permanent dentition, that is the canine, has erupted. So the answer to the question, the last succedaneous tooth to erupt is the maxillary canine. And if you see what is the first tooth in order to erupt is the mandibular central incisor. So the mandibular central is the first succedaneous tooth to erupt and the maxillary canine is the last succedaneous tooth to erupt. And at the same time, premolars are the only succedaneous teeth having a different name than their deciduous counterpart. So we should have that also in mind. Moving on to question number 4. The cross section of maxillary permanent lateral incisor root at cervix is, they've given 4 options: triangular, circular, oval, and diamond. The answer to this question is oval. So moving on to question number 5. The gubernacular cord guide the eruption of, they've given 4 options: permanent teeth, primary teeth, both, and none. The answer to this question is permanent teeth. So what is this gubernacular cord? This gubernacular cord is located in the gubernacular canal. This actually links the tooth follicle to the overlying gingiva. This can be identified in the alveolar lesion of the lingual or the palatal surface of the deciduous teeth. So moving on to question number 6. The last deciduous tooth to erupt is, they've given 4 options: A, D, C, and E. The answer to this question is E. So moving on to question number 7. Resorption of incisor canine during shedding occur in the apical and lingual direction, in apical and buccal direction. It depends on the root angulation or it is not specific. The answer to this question is in apical and lingual direction. So moving on to question number 8. Calcification of permanent tooth starts at, they've given 4 options: at birth, 6 months after birth, intrauterine, and 10 months after birth. The answer to this question is at birth. So moving on to question number 9. Superiormost part in envelope of motion is occlusal contact, TMJ occlusion, ligament, and muscle. The answer to this question is occlusal contact. Moving on to question number 10. Butt joint in cemento-enamel junction is seen in how much percentage of cases? They've given 4 options: 10, 30, 60, and 90. The answer is 30.